Hey friends, welcome to Therapy Thursdays on Louisiana Living. We are Physical Therapy and Balance Centers. I'm Angela Yarborough and this is Dr. Jerry Yarborough. And we are coming to you from our Ruston location. We also have a Jonesboro, Louisiana and an El Dorado, Arkansas location. But we just wanted to explain to you what we're doing here and how we can help you live your life.
That's right. So here on Therapy Thursdays, what we're going to be doing is talking about different diseases and impairments that affect your quality of life.
And in the next couple of segments, we're going to show you exactly how that works and what we can do for you. But just remember, we're not here on TV just talking. We actually have physical locations that you can come see us. How does that work, Dr. Jerry?
That's right. In Louisiana and Arkansas, you have what's called direct access. That means you have direct access to your physical therapist. You do not have to have a referral, although we always work well with all the primary care providers around. And so just pick up the phone. If you need physical therapy, give us a call, and we'd love to help you love your life. Come back in the next segment and we'll get started.
Welcome back to Therapy Thursdays. We are Physical Therapy and Balance Centers on Louisiana Living. I am Angela Yarborough, Dr. Jerry Yarborough. And today we're going to talk about fibromyalgia. Let's break down that word a little bit. So fibro is soft tissue, tendons, ligaments. My is muscle, and algia is pain. So it's basically, it presents itself as pain all over and just fatigue. So tell us a little more about that.
Okay, yes ma'am. For many years, fibromyalgia was not believed to even be a true diagnosis. Doctors many times told their patients, it's just in your head. And the reason is because blood tests and x-rays don't show anything. And many times doctors say that it's in your head. It's just a poor choice of words in that they don't see anything that's causing the pain. Not that you don't really have pain, because believe me, I've worked with plenty of people with fibromyalgia and they truly have pain. And they have pain all over their body in different areas, and especially trigger points in certain parts of their body that are very severe. The fatigue is extreme and it's real. These people can be extremely debilitated and it really affects their life. So like I said, blood tests and x-rays don't show anything. So many times it's even misdiagnosed as like chronic fatigue syndrome, which is another kind of poorly understood impairment. But anyway, with fibromyalgia, they do diagnose it. Your medicine doctors are going to diagnose it as according to your history, what you're telling them now. Now they do understand that it's a real diagnosis, so they listen to your history. But also there's tender points that I talked about. There's 18 certain points in your body, some here in the front of your neck and chest, some in the back of your head, back of your neck, some in your elbows, some in your hips and your thighs. So your medicine doctor is gonna touch those, and if you're painful in 11 out of 18 of those areas, then that's a positive diagnosis, and you'll be diagnosed with fibromyalgia. Fibromyalgia is a chronic condition, meaning that it lasts a long time. 25% do actually recover within 2 years. But fibromyalgia is serious, and it's something that has to be managed. You don't just sit by and accept it. You can go into remission. You can continue to live a productive life. And that's where physical therapy is going to come in to help you be able to manage that. So in our next segment, we're going to talk about that. So come back and we'll talk about how physical therapy can help you and things you can start doing immediately to help manage your fibromyalgia.
Welcome back to Therapy Thursdays with Louisiana Living. Angela Yarborough, Dr. Jerry. We're continuing our discussion on fibromyalgia. So,
yes, so real quick again, a recap. Fibromyalgia is a poorly understood medical diagnosis, and it is global pain, extreme fatigue, and I mean it can lead to depression, increased stress, decreased sleep, and of course decreased functional abilities completely. So it's very important if you have fibromyalgia to include physical therapy as in your team to those that are helping you manage it, because it is a chronic condition and it can last for years. So it's serious that you manage it. So with physical therapy, we're going to go over a gentle stretching and gentle exercising program, okay? We're going to go over breathing techniques and relaxation techniques to help you decrease the stress and the serotonin levels in your body. We're going to talk about different exercises and different modalities, as we call them, or machines that we can use to help. We can do trigger point dry needling for those therapists that are certified, which we are here at our physical locations. We have different machines like ultrasound, massage may help. Different things like that physical therapy can help. Remember, it's chronic. It's not something you're going to hit with high-powered exercises. If anyone tells you that, turn and run, because that's going to cause you a lot more pain and a lot more sleepless nights. So don't get down that you can't do anything, because you can. You can if you manage it. The medicine doctors can more than likely give you some medications that will help manage it also. But that's only one component. So some good takeaways for you today. If you've been diagnosed with fibromyalgia, remember you have direct access. Call your physical therapist, get an appointment, and include them in your treatment team. All right. Start exercising, just walking. Try to walk on a daily basis, and don't start off trying to walk a mile. Get out and try to walk, 5 minutes, and then 10 minutes. Just get your body acclimated to being more active. We'll teach you some stretching techniques and exercises. It's very important, because you become stiff, you feel like you're swollen, although you probably aren't. You feel real stiff and swollen. So stretching exercises are really important. And of course, healthy eating, decreasing stress and relaxation, and then getting good sleep. So, all right, guys, that's fibromyalgia. We appreciate you trusting us to help you love your life. Remember, physical spelled different because we are different. We love to help you here on TV and here at our clinics. Thank you, and we'll see you next week.